Hey guys, welcome back. Today we're addressing an article that appeared recently in the New York Times about a supposed new treatment for hair loss. Now, hair loss is something that will affect a majority of men, and it can affect a whole lot of women as well. So what is this new hair loss drug, and does it hold promise for a large number of people? I'm Dr. Dustin Portella. I'm a board-certified dermatologist, and I've helped millions of followers online to be healthier by sharing scientifically backed skincare advice and health advice, and I want to help you to be more healthy and beautiful inside and out. So what is the drug that we're talking about today? It's actually Minoxidil, and you may have heard that name before because Minoxidil is the active ingredient in a commonly used over-the-counter hair loss treatment called Rogaine. Now, to understand why Minoxidil is making a comeback, we need to go back and look at why we have Minoxidil in the first place. Minoxidil was originally being developed as a treatment for blood pressure. And so they noticed in the clinical trials as they were giving more people the active ingredient, Minoxidil, that they started to grow excess hair all over their body. Now, this was not the best drug for blood pressure because it could lead to a significant drop in blood pressure and the potential for a rebound when it wore off. And so it never made it very far as a blood pressure pill. However, because it had the potential to cause hair growth, it was manufactured into a lotion, a foam, a liquid, and eventually it was approved by the FDA for over-the-counter use for men in 1988, and guys have been using this for hair loss ever since. In 1992, it was subsequently approved for women, and women it was approved at a 2% concentration, and men it was approved at a 5% concentration. And as time went on, what we found is that for many women, the 2% just didn't work very well, and now some brands are actually making a 5% that is marketed towards women. I often tell my own patients if they're picking up Rogaine or Minoxidil over the counter to just buy the men's 5% because it seems to be safe and it's more effective. Despite the long-term use of topical Minoxidil, it really has left some people disappointed because it doesn't work for everybody, and there's a couple reasons for that. One, it's not very easy to use in a compliant manner, especially for women. If you have to put something in your hair on your scalp and it's sticky, it doesn't feel good, you might have to wash your hair more frequently, you're just not going to use it consistently. And with any hair loss treatment, you really have to use it consistently in order to get good results. Another reason is that Minoxidil by itself doesn't help you to grow hair. It has to be converted into its active form by enzymes in the body called sulfotransferase enzymes. These enzymes may or may not be present in abundant concentrations near the root of your hair. So if you have this enzyme, then you're going to get probably a better result from using topical Minoxidil. But if you don't have a ton of this enzyme, you're not going to see as much of a result. And this may be one of the reasons why if you do respond to Rogaine, you're much more likely to respond on the back of the scalp than at the front. So we know that using topical Rogaine, topical Minoxidil for men, gives better results at the back of the scalp than at the front. Now, as time went on, because Rogaine didn't help everybody to grow their hair, a lot of other treatments have been developed with great promise and lots of marketing. In fact, the hair loss industry is billions of dollars every year on shampoos, solutions, PRP, injections, PRP microneedling that can be done at a dermatologist, supplements, all sorts of things that are marketed to help individuals to grow hair. And then for people that go bald, we have scalp micropigmentation. We have a whole industry that is focused around hair transplantation because hair is so important to so many people. What we found, however, is that many of these other treatments also didn't have a lot of promise. They didn't come and deliver the results. And the way that I look at hair loss with my patients is I have them do as many things as they can reasonably do because there's no magic bullet, there's no one single thing that leads to hair regrowth in every person. So if you can afford to do lots of little things, you're more likely to get a better result. Now, one thing that it is important to know that oral Minoxidil is what we would call an off-label use of a medication. When we look at on-label and off-label use, what that means is, has this particular medication been approved by the Food and Drug Administration of the United States, the FDA, for the specific purpose that we're using it? If it's been approved, that means it's had clinical trials, those double-blind, randomized, placebo-controlled trials that showed that the drug was beneficial for that specific condition. And we have that for many medications in and out of dermatology. But dermatology is one specialty in which we frequently use medications in an off off-label manner. Because as physicians and as dermatologists, we learn the pharmacology of these medications, we understand the risks and the benefits, and we know how to evaluate those risks and benefits in each of our particular patients, we can often use medications for conditions in which they're not approved by the FDA, and we can do that safely. So we often have many different types of steroids. So we have betamethasone, we have clobetasol, we have hydrocortisone, and not necessarily have every one of those medicines been specifically approved for psoriasis and eczema and lichen planopilaris and all these different things. But because we understand the pathophysiology of the disease and the pharmacology of the medication, sometimes we're able to match up things that have not been approved by the FDA. And that is legal and it is safe to do when it's done by a board-certified dermatologist. So minoxidil is not approved in its oral form for the treatment of hair loss. So that is important to know. That doesn't mean in and of itself it's unsafe. It just means that you need to have this prescribed after a consultation with a physician to determine if it is right for you. And that's really what it means to be taking a medication off-label. Now, to understand where oral minoxidil comes from, which is the New York Times article today, we have to look back at a dermatologist in Melbourne, Australia about 20 years ago. Dr. Rodney Sinclair was at the University of Melbourne, and he had a female patient with hair loss who had been using Rogaine pretty consistently and was actually getting good results. But over time, she started to develop an allergic reaction to the topical application of Rogaine and got to the point where she just couldn't use it because she was having rashes and itching. But when she stopped using Rogaine, then her hair started to fall out again. And so this led Dr. Sinclair back to the minoxidil pills. They have been released for blood pressure. They're not the go-to blood pressure for many people. However, he decided to start cutting the pills in half and then by fourths. And he tested this dose on his patient, and just by taking the pill, she was able to regrow hair. This led him to try it on more and more patients, and in 2015, he presented his data to other dermatologists and showed that in about 100 patients, he had great success in hair regrowth among the patients that he had given oral minoxidil. And eventually he had refined his protocol and gotten it down to about a 40th of a pill. So we're talking super low doses of oral minoxidil, leading to good results. Now, in corresponding with other dermatologists, I have noticed that more and more dermatologists have been using this since 2015, prescribing it for their patients, because pills are often easier than applying a topical medicine to your scalp, especially if you have hair that you have to style and wash. It's much easier to take a pill. Also, what we see is that because these pills are such a low dose, we're able to take them and see the benefit of hair growth without causing a significant drop in blood pressure, or really without affecting someone's blood pressure at all. Also, when it's taken orally, it gets converted into its active form at a much higher rate. We don't have to depend on enzymes present or not present in the scalp in order to make the drug work. One other benefit to oral minoxidil is because it has been on the market for literally decades, it's super cheap. You can get this for pennies. Now, if there's a marketing opportunity, I think you can trust to see a pharmaceutical company raise the price of it. And I do think you're going to see some of the online services like Hims and Keeps start to offer this if they don't already offer it, and they'll charge a premium for it because they're using their own pharmacies, and that's part of their business model. And I'm not saying it's bad. It does open up the doors to a lot of people to get treatment for hair loss. But what I would tell you is that if you can go and see a board-certified dermatologist who can safely prescribe this for you, oftentimes they're going to give you enough refills that you don't have to pay a monthly subscription fee. You probably pay a little bit more upfront for that initial visit, but then you're going to get, I prescribe my patients a year's supply of refills, so they don't have to come back and see me, they don't have to call the office, they don't have to do that every month, and in the end it does save them money. Now, not everybody should just rush out and try to get oral minoxidil. You should have a conversation with your doctor to make sure it's safe for you, especially if you do have blood pressure issues, if you're on other blood pressure medication. But when we look at all of the options available to treat hair loss, I think oral minoxidil becomes a really valuable tool in our armamentarium. There are other medicines that you can take orally that can also help to regrow hair. One of the most well-known is Propecia. Propecia, the generic name is finasteride, and this is one that blocks the hormone at the root of the hair follicle that causes the hair to fall out. We have this hormonal process that happens in most guys as they age, where testosterone in the body is converted into something called dihydrotestosterone by an enzyme called 5-alpha reductase. and finasteride blocks that enzyme so that circulating testosterone is not converted to dihydrotestosterone at the hair follicle. And this is a really effective and also very inexpensive treatment. There are reports of some guys who have had some side effects from this medication, so it may not be for everybody. I often prescribe finasteride to my patients, and I've had nobody complain about significant side effects. I've also prescribed it for women because women experience far fewer potential side effects from finasteride. And finasteride has a cousin called dutasteride, which may be even more effective, but it is just slightly more expensive. And most of these oral medications can be combined with topical minoxidil or Rogaine, or you can talk to your dermatologist about getting a compounded medication. And this is something that I do frequently for my patients with hair loss, as I work with a compounding pharmacy and a technology platform called HairStim to do topical minoxidil with topical finasteride, so they can put that on the scalp, and oftentimes they're taking a pill as well. So we're really attacking the hair loss from the outside and from the inside. I have talked about HairStim and its cousin tech platform, Skin Medicinals, on another video in the past. Now, undoubtedly, some of you watching are probably wondering about my own hair loss. I have talked about my hair loss journey on another video, and I would encourage you to go watch that. I've been through a lot of different treatments and ultimately decided that I didn't want to take a pill for the rest of my life. And that is, I think, a very valid decision for myself and for a lot of other guys. And I'm very happy with my decision to just shave my head, but I do break down all of the things that I went through when I was at the point in my life when I was trying to hold on to my hair. There's a lot of other things out there that could be used to treat hair. Let me know what you guys think about oral minoxidil as an option, or if you've tried it, or what other things you may have tried for hair loss. And if you found this video helpful, do me a favor and share it with somebody else who could benefit from learning a little bit more about evolving and new treatments for hair loss. Thank you for hanging out with me, and I'll see you guys on the next video.